morning, the Dean of Faculty of Nursing Science, my HOD, all the lecturers seated this morning, and all the students. I am Michael Grace Olaoluwa, and my seminar presentation is on improving patient safety and quality care, addressing knowledge gaps and best practices in nursing. Lesson outcomes. These are the objectives. At the end of this presentation, participants will be able to explain the importance of patient safety and quality care. They will be able to identify the knowledge gaps in nursing, also describe best practices for improving patient safety and quality care, and address knowledge gaps in nursing and implement the culture of safety. Now, these are my outlines. By way of introduction, patient safety and quality care are pivotal concerns in the healthcare industry, especially within the nursing practice, because the dynamic and multifaceted nature of the healthcare environment necessitates that nurses possess up-to-date knowledge and up-to-date and proficient skill in an unwavering commitment to the care that we give to our patients, and to also ensure best practices and optimal patient outcomes. Therefore, we must talk about patient safety. However, when there are knowledge gaps and inconsistencies in the practice that we render, it will pose a significant challenge. And some of the challenges are what this paper aims to address or explore. And also, we want to propose best practices through which we can bridge these knowledge gaps and ultimately improve our patient safety and improve the quality of care that we render to our patients. Now, what are the importance of patient safety and quality care? It is highly germane. Patient safety and quality care, they are fundamental to healthcare delivery, and they influence patient outcomes, the satisfaction, and overall healthcare system efficiency. Therefore, it is essential we must pay attention to patient safety and the quality of care that we give to our patients. The meaning of patient safety, it simply entails preventing harms to our patients during the process of healthcare. That is, while we are rendering our care, when we are trying to help the patient, ensuring there is no harm to the patient in the process of caring for the patient. Then, quality care, that one encompasses providing services that meet established professional standard and result in desired health outcome. That is what is globally accepted, with the standard that is globally set. When we give a care that meets up with such a standard, that is providing a cutting edge care delivery for our patients. Then, but when there is lapses in safety, it will compromise the quality of care that we intend to give, and that will lead to adverse events such as patients experiencing falls, or maybe we get error in medication, and that will result in increased morbidity and mortality rate, which we are trying to prevent. Now, identifying knowledge gaps in nursing. From the diagram above, we can see that when we talk about knowledge is encompassing, especially in nursing. We have the theoretical knowledge, we have the practical knowledge, we have the technical aspect of it, and we have the research area. When all this comes together, it forms the bulk of knowledge. But wherever there is a gap in any, like you can see these hands that join hands together to provide knowledge, here there is a gap in this diagram. The gap can be from maybe in terms of area of communication, maybe in the area of technological skills, or maybe in the area of theoretical or research aspect of nursing. If there is gap in any aspect of it, then the knowledge will not be complete, and there will be a gap in the care that we give. Now, identifying these knowledge gaps. One, we talk about clinical knowledge and competency. That is the knowledge of technical know-how. How do we render the care that we give? How competent is a nurse to give the care you are giving? Nurses often manage complex clinical scenarios that demand a high level of expertise and critical thinking. As nurses, we come across different cases, different clinical scenarios. It may be in the surgical field, in the medical field, in the pediatrics, in several areas that are encompassing, and therefore the nurse is expected to have enough expertise in critical thinking and having ability even to identify what is supposed to do. So when there is a gap in the clinical knowledge or in the competence of delivering the care, there will be inadequate patient assessment. For example, a patient comes in with different kinds of complaint. As a nurse, you must have ability to have critical thinking to assess the patient and come out with the ideal and proper diagnosis, which will result in the appropriate care plan. Where the assessment is error, there is error in assessment, then diagnosis there will be error, and therefore the care plan will be inappropriate. Therefore, we should ensure that in the area of clinical knowledge and competency, if it is not well placed, then there will be a gap there. Then continuous professional development and education, continuous education will help to address these gaps. Now, evidence-based practice is another area of gap. This ensures that care is grounded in the best available evidence. This one refers to research. Many nurses struggle with understanding and applying research findings to clinical practice. So in the aspect of research, we must be grounded in the aspect of research. But in the knowledge gaps area today, we see that in this area of evidence based, many nurses are lacking in the knowledge of this. Many cannot even conduct ideal research. There are so many reasons that causes this. For example, when there's limited access to research, time factor, insufficient training in research methodologies. Some even have the time they carry out the research, but they keep the results to themselves. But what we are saying that when this occurs, there will be a gap in the aspect of management. For example, in the olden days, the method we use in the treatment of pain. Today, through research evidence, we have been able to improve on what we do. When we have a patient that comes in with pain, we assess them based on scales, unlike in the olden days. So, in this area of evidence-based practice, research is essential in ensuring that we meet up with the standard of care. Now, technological proficiency. We are in a dynamic world. The world is not stagnant. The instrument you used yesterday may not be enough for to care for the patient of today. Therefore, technology integration is essential. But where this is lacking, there will be a knowledge gap there. For example, the electronic health records today, the telehealth, whereby you can through all this through online and the rest, you can access your patient. The patient can access you can make use of equipment that you just press on this and it will lead to the patient. Press on this, it will be patient even through the rail without the patient experiencing fall. But if the nurse does not have the technological proficiency in carrying out this, definitely there will be a gap in that. The revolutionized patient care, technological proficiency remains a challenge today for nurses who are less familiar with digital tools. We are in a digital age, and nurses are expected to also come up with digital tools and be able to make use of it. But where certain nurses are not exposed to these digital tools, there will be a gap in the care they give. Then this gap can lead to errors in documentation, yes, and also delays in care and compromise the patient safety. Just like I said, today we have wheelchair that will just press, that will help the patient to move up. We have wheelchair that you can press and just pull the patient down the rail without experiencing any form of fall. Now, communication and collaboration is another gap. Among healthcare teams, it is vital for patient safety and quality care. Where there is no good communication and collaboration among the healthcare givers, definitely there will be errors. Imagine the morning nurse not documenting or not communicating well with the afternoon nurse, and the afternoon nurse now coming back to repeat the same medication that has been given in the morning, which is not nothing, just because of the poor communication. It is not only among nurses, but among healthcare as a team, healthcare member, the professionals, the doctors, the nurses, the pharmacists, everybody should work together as a team. But where this is lacking, definitely there will be error and there will be knowledge gap. So knowledge gaps in this area will result in misunderstandings, fragmented care. You follow your path, I follow my path, and at the end of the day, the patient will not have the quality care that the patient demands for. Increased risk of errors, especially in the area of medication, when the doctor does not communicate with the nurse and the nurse refuses to communicate with another incoming nurse, there will be errors. Enhancing communication skills and fostering a culture of teamwork will help to bridge this kind of gap. Now, what are the best practices that we can employ in order to improve patient safety and quality care? One, there should be continuous education and training. Continuous education and training. The ongoing education and training for latest clinical guidelines. Then regular workshops, simulations, and access to online resources. These are the things that will help us in terms of education and in terms of there are so many things online these days you can easily lay your hand on by ensuring that you move with the trend. Now, promoting evidence-based practice, just like we have said that the way we can achieve best practice in order to improve our the safety of patients is by promoting evidence-based practice. And what can we do in this area is to engage in research activities. Nurses should be encouraged to engage in research activities, and then training on research methodologies and implement research findings. When we integrate research findings into what we do, it will also help us. Then, just like we can see from this picture, improving communication and collaboration, just like I said, is an area that actually cause gaps in the care we give to our patients. For example, you can see these people here, the nurse, the doctor, the pharmacy, they are collaborating together on what to give to the patient. They discuss about it, working together as a team. So delivering quality care and ensuring patient safety calls for a teamwork. We have to work together as a team, even among nurses and among other healthcare professionals. Now, another area that we have to address, the specific areas that we have to address is one is this issue of medication administration. You know, more than 50% of errors are traceable to medication error because it results from knowledge gaps in pharmacology and improper dosage calculations and medication errors, inadequate patient education. You know, when patient is not properly educated on which one to take in the morning, which one not to take. Imagine a patient that's supposed to take a drug one in the morning and one in the evening, and the person just wrote one and one, meaning 11. The patient went ahead to take 11 tablets. Imagine that. That is gross medication error and inadequate patient education. So in this what shall we do? Implementing medication safety protocols, such as ensuring all the rights of drug administration, the right patient, the right drug, the right dosage, right anatomical site, and ensuring that all these rights are put in place in administering the medication. Then double checking and ongoing pharmacology education, as we know that we are in a dynamic world, things are changing, so we should brush up our knowledge in the pharmacology. Another specific area that we need to address is the area of infection control. Today we see so many patients that come to the hospital with one condition going on with another condition, another disease condition, which is called nosocomial infection. It needs to be addressed. So all these healthcare associated infections, infection prevention strategies should be put in place, such as hand hygiene, the use of personal protective equipment like the glove, the face mask, the apron and the rest. Then proper sterilization techniques should be emphasized, you see, and regular training through adherence to infection control guidelines. The nurses, they should be trained on the proper way of sterilization. Now, another area that we need to address is patient assessment and monitoring. Accurate patient assessment and monitoring should be ensured. Then this will help in early detection of clinical deterioration. Then it will enhance nursing skills in comprehensive patient assessment, and vital signs monitoring is highly essential, and the use of early warning scores. Then simulation-based training and education on assessment techniques will also help both the nurses who are practicing and the students also. This will also help them to move on. Now, pain management is another specific area that we need to address. Effective pain management is a critical aspect of quality care. Knowledge gaps in pain assessment and analgesic options and non-pharmacological intervention. All these are areas that we need to really pay attention to. Providing education on pain management strategies and encouraging the use of pain assessment tools. In the past, the way we manage pain in the past is different from the way we manage pain now. Now we weigh pain on scales. The way you will manage a pain that is on scale 1 or 2 is different from the way you manage pain on the scale of 6 or 7. So all these tools have to be put in place in the effective management of pain. Now, implementing a culture of safety involves fostering an environment where safety is prioritized and errors are openly reported, analyzed, and improvement is encouraged. How do we go about it? When we allow an environment whereby our priority is to ensure safety, therefore if there's any error, if there's anything that happened that negates this, the nurses should be able to come out openly to report this, and when this is reported, it should be analyzed and improvement should be encouraged rather than hiding it and keeping it because of fear of being punished. Then leadership commitment is another thing. Leadership plays a crucial role in establishing and maintaining a culture of safety. So allocating resources to setting safety goals and supporting safety initiatives. Then another area is encouraging reporting and transparency. Just like I've said, we should encourage people, nurses, to report any error that occurs, without being punished. For fear of punishment, some will keep their error to themselves. But if it is sure that, if I report this thing, I will not be punished, rather I will be corrected, and others will learn from it. Then implementing anonymous reporting system. It also encourages the culture of safety. Then regular safety audits should also be done in hospitals, both even in hospitals and even in the care we give at home. So all these things will help to ensure that our patients enjoys the true safety. Then standardizing procedure, standardizing clinical procedures and protocols, ensuring that we follow the global standard that is generally acceptable, will also be of help in implementing the culture of safety. Now, what are the roles of education? Does education have any role to play in ensuring safety and in ensuring quality care? Yes. Nursing education is crucial in preparing future nurses for safety, to provide safety care and quality care and safe care. Now, curriculum, critical thinking, clinical decision making, and evidence-based practice. All these things are essential. In our education, it should be boosted in such a way that even student nurses, they will learn all these things, how to make use of evidence-based practices, how to take clinical decisions, how to think critically. All these things should be involved in our curriculum. Then simulation-based learning, interprofessional education, clinical placement. All these things will help in boosting our knowledge as nurses. For example, in this interprofessional education, it's not compulsory it should be nurses to nurses only. No, nurses and doctors can come together and rub minds together and attend training together. The pharmacists can be in attendance, then we rub minds together. Oh, this one is working, this one is not working. Then bring the ideas together. That will improve our patient safety. So that is one of the roles of education. Then simulation-based learning is also providing a safe environment for students to practice clinical skills, whereby we have a big laboratory where students will have access to demonstrate and practice, even with high fidelity simulation that can replicate a real life situation for students. They will be able to practice and lay their hand on so many skills, and thereby boosting their competency in attending to real life situation. Then interprofessional education, it involves learning alongside students from other healthcare disciplines. That's it. Both nursing students, the medical students, the pharmacology students, and all of them, bringing them together. It fosters collaboration, understanding the perspectives of other professionals, and that will even help in providing adequate care and quality care. Preceptorship programs, whereby experienced nurses will mentor the students and thereby enhance their competence in the practice. Now, what is the implication of all this to nursing? Knowledge of patient safety, quality care, and best practices has significant implications. One, for nursing education, nursing research, and nursing practice. In education, it will be just like they have said, our curriculum will be broadened, and people learning and continuous education. Then nursing research, nursing is emphasized, and nursing practice also, it will boost our practice, and patients will enjoy our quality care. Now, conclusion and recommendation. Improving patient safety and quality care requires addressing knowledge gaps, implementing best practices, continuous education training, promoting evidence-based practice, and technological proficiency, as well as effective communication and collaboration. All this with culture of safety and emphasizing the importance of nursing education will help in ensuring that we have what we call patient safety and quality care. And also, we recommend that healthcare organizations, they should ensure that nurses are well equipped to provide a safe and high quality care. Make the environment easy for the nurses to provide this quality care, and also improve the skills of the nurses and their knowledge by encouraging their education and boosting their chances of improving their knowledge. Thanks for listening. These are my references.